these programs. Additionally, the Centers for Medicare and Medicaid Services, CMS, approved Michigan's application to establish a 5-year Medicaid demonstration, Flint, Michigan, Section 1115 demonstration, in response to the public health emergency of lead exposure related to the Flint water system. The U.S. Department of Agriculture's Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, is allowing participants to use WIC vouchers for ready-to-feed infant formula, which does not need to be mixed with water. Participants can also swap powdered formula for ready-to-feed formula. WIC participants are being referred to the local health department for lead screenings and provided nutrition education on mitigating lead absorption through dietary changes. These steps should help expand services available to ensure access to needed medical, social, educational, and other services. We're eager to hear of other options that may be employed to alleviate the potential impacts lead can have on health. I look forward to our hearing today. Thank all of the witnesses on both panels for participating in this important hearing. Anyone see?
No one has asked time.
Anyone on our side seeking time? Not? I'll yield back and recognize the ranking member, Mr. Green, 5 minutes for opening statement.
Thank you, Mr. Chairman. Good morning, and thank all of you for being here for this important hearing. The drinking water crisis in Flint, Michigan is a national tragedy. It's a preventable man-made disaster that should have been intervened months before it caught the nation's attention. Most tragically are the estimated 8,000 children under the age of 6 who are exposed to unsafe levels of lead who may not need lifelong services to live fully productive lives. Childhood lead poisoning is a tragedy impacting communities throughout our United States. The Centers for Disease Control estimates that approximately 500,000 American children under 6 have blood lead levels above 5 micrograms, the level recommended for public health actions to be initiated. Children from low-income communities, communities of color, like those in Flint, and communities I have the honor representing in Houston, Harris County, Texas, are 2 to 3 times more likely to have elevated blood levels based on CDC data. No child in America, regardless of background or income, should be a victim of lead poisoning. The city of Houston has been proactive on this issue. Houston is one of the 6 cities to be part of the CDC child lead poisoning prevention programs, with the ambitious goal of eliminating childhood lead poisoning in the city by 2020. In 2013 alone, over 24 children were screened for lead, and since 1996, nearly 3,000 homes have been remediated for lead paint. I support these efforts, but more must be done to ensure that every child is tested for lead, and all older homes are lead paint-free in Houston and across the nation. Unfortunately, the CDC program has drastically cut in recent years, from $30 million in 2011 to $15 million last year. Health and Human Services, working with Congress, must ensure that this and other similar programs get resources they need to protect our children from lead exposure. The recent study conducted by the American Water Works Association estimates that there are 6.1 million lead service lines used nationwide, serving 15 to 22 million Americans. These lead service lines are greater concentrated in Midwest and Northeast. LSLs are found in every state. My home state of Texas is estimated to have 270,000 lead service lines still in use, 8th highest in the country. If we're going to eliminate lead out of our drinking water once and for all, our nation must commit to the comprehensive plan to replace lead service lines. This will necessitate coordination between water utilities, city, states, and EPA, with a sizable commitment of resources from the federal government to support local communities and low-income households replacing their lead lines. I'm proud to join my colleague, Representative Paul Tonko, as an original co-sponsor of the Aqua Act, which would reauthorize Safe Drinking Water Act for the first time in 13 years and give states greater resources to update our nation's aging drinking water infrastructure by increasing funding for the state revolving fund.